Hi guys, welcome back to TU Network. I'm Carlo and I'll be your host today. Today I have invited some experts to explain about the well-known drug, opium. Before that, let me ask you, have you wondering where does opium come from? The answer is the Papaver somnifera, which also known as poppy plant commonly. It is the soy source of opium. Poppy plant is an annual plant and can grow up to 5 meters tall. It sits bound in capsule, which has a disc structure above and will be spread through pores under the disc-shaped structure. Did you know it has a lot of usage? For example, it can be used in the making of pastry and produce high-quality oil. Besides that, its beautiful flower can be used for decoration. Next, I will pass to Dr. Yap to explain more about the opium.
Opium is a narcotic drug which is obtained from the seed pods of the opium poppy, or otherwise known as Papaver somniferum. And being a depressant drug, opium slows down the speed of signals traveling between an individual's brain and body. So this means that physical activity is lowered when the drug is in effect. And opium affects everyone differently based on several factors, and these factors are the person's size, weight, and health, how regular they use the drug, whether or not other drugs are taken at the same time, the amount of the drug taken, and the strength of the drug. And the short-term effects can include impaired reflexes, temporary constipation, loss of appetite, euphoria, relaxation, slower breathing, and lower heart rate.
Morphine is a type of opioids and was first isolated from opium in 1803. It is usually used as a pain relief medication due to its ability in binding the opioid receptor in the nervous system to reduce pain. It has several routes of administration, and the most common one is the parenteral routes like subcutaneous, which is injection under the skin, intramuscular, which is injection to muscle, and intravenous, which is injection directly into veins. However, it could also be taken in through the anterior route orally, sublingually, or even just the inhalation route. A downside of morphine as a painkiller is the risk of getting addicted to it. Before we talk about morphine's mechanism, we need to bring in two key roles: a happy hormone called dopamine, which produces the feeling of well-being, and a neurotransmitter called the GABA. Usually, GABA slows down the rate of release of dopamine to the dopamine receptor and reduces the rewarding effect. However, with the presence of morphine, it as an opioid will bind to the receptor on GABA inhibitory neuron and reduce GABA's activity. When GABA's activity is being reduced, more dopamine will be released and induce pleasurable feelings. As the body gets used to euphoric effect of the drug, the brain will get adapted to the abnormal level after being exposed to the drug over a long period of time and pull it back to normal. This causes the current dosage to be unable to produce the desirable psychoactive effect, and a higher dose is required to do so. This repeat cycle will eventually lead to the drug overdose, and this is why morphine is usually known as the drug of abuse as well.
Hi, I'm Dala, and today I'm invited to make a brief talk about codeine. Similar to morphine, codeine is an opiate, but it is a prodrug of morphine, which we'll elaborate on that later. Although codeine makes up about 2% of opium, it is the most commonly consumed opiate and the most commonly used drug overall. The use of codeine is heavily regulated as it may cause addiction, which brings withdrawal symptoms if a person suddenly stops the medication after a chronic use of it. Now I will briefly explain about the uses of codeine. In the past, codeine was used as the starting material of multiple mild or strong opioids. It is used to treat pain, especially post-surgical dental pain, coughing, and diarrhea. On the other hand, codeine is also used in illegal drug labs to make morphine. It is also an ingredient of a recreational drug, which is called lean drug. Codeine has multiple routes of administration, such as oral, injection, and inhalation. It is an agonist of the mu-opioid receptor, which we will call it the MOR. It acts on the central nervous system to have an analgesic effect. It is also metabolized in the liver to produce morphine, which is 10 times more potent against the same receptor. and that is why it is called the prodrug of morphine. Now for the safety dosage of codeine, poisoning due to codeine and its salts are actually really rare. Some reported cases have recovered after taking approximately 500 to 520 mg of codeine. That is all for my brief explanation. Thanks for listening.
Heroin is a very addictive drug made from morphine, as Darren have mentioned, a psychoactive mind-altering substance taken from the resin of the seed in a pod of opium poppy plant. Heroin binds to activate specific receptors in our brain called mu-opioid receptors, also known as MORS. Our body contains such natural occurrence chemical called neurotransmitters that binds to these receptors throughout the brain and body to regulate pains, hormones release, and feeling of well-being. And the route of administration is the same as codeine and morphine. Heroin is often mixed with water and injected with a needle so it can be sniffed, smoked, or snorted.
I'd like to start off with how long each of the drugs stays in our system. For codeine, half of the dosage of codeine taken leaves the body in about 3 hours. For morphine, a single dose of morphine is usually eliminated within 72 hours. And for heroin, it usually has a peak rush of feeling euphoric for about 30 minutes, but even after 4 to 5 hours after use, it will still affect the person. What were they originally used for? Codeine was originally used to treat cough and diarrhea. Morphine was originally used to block pain, and heroin was originally marketed as a solution to morphine addiction. The route of consumption of the three opiates differ as well. For codeine, it is usually as syrups or tablets, morphines are usually as tablets, and heroin is usually snorted, smoked, or injected. The potency of the three opiates is arranged from codeine to morphine to heroin, codeine being the least potent and heroin being the most potent.
In conclusion, when we talk about the opium, the bad side of opium always comes to our mind first. We have forgot about the good side of opium. Thus, after this interview, I hope everyone can think more about the advantages of opium instead of its bad side. Thank you so much for your time.